Stop scrolling for just 5 minutes. If you're over 50, there's a good chance your blood pressure is quietly working against you right now, and you might not feel a single symptom. That's the frightening part about high blood pressure. It doesn't announce itself. No pain, no warning signs, nothing you can feel. Doctors call it the silent pressure for exactly that reason, because by the time people notice something's wrong, it's often already affected the heart, the kidneys, or the brain. Please, my name is Dr. Mary. I've spent years working as a cardiologist with patients in their 50s, 60s, 70s, and beyond, helping them understand what's actually happening inside their arteries, and more importantly, what they can do about it. Before we go further, I'm not your personal doctor, and nothing here replaces medical advice from the physician who knows your history. If you're on blood pressure medication already, please don't stop or change your dose without talking to them first. What I want to give you today is real practical information you can bring to that conversation. So let's talk about what's actually going on. Blood pressure is simply the force of blood pushing against your artery walls. As we age, those artery walls naturally lose some flexibility. Think of a garden hose that's been left in the sun for 20 summers versus a brand new one. Add in factors like diet, stress, and activity level, and that pressure can climb slowly, year after year, without you ever noticing. The good news? Research consistently shows that lifestyle changes can meaningfully help manage blood pressure for many people, sometimes significantly. Let's get into 5 approaches that are genuinely worth your attention. Number 1, cut back on hidden sodium, not just the salt shaker. Most excess sodium in people's diets doesn't come from the shaker at all. It comes from canned soups, deli meats, bread, and packaged sauces. Try this. For 1 week, check the sodium content on 3 things you eat regularly. Many people are shocked at what they find. Swapping even a few high-sodium staples for fresh or low-sodium versions can make a real difference over time. Number 2, move your body, but not in the way you think. You don't need intense workouts. Research points to something simpler, consistent, moderate movement, like a brisk 20 to 30-minute walk most days of the week, can support healthier blood pressure levels. The key word is consistent, not intense. If you're just starting out, even a 10-minute walk after dinner is a meaningful start. Number 3, watch your potassium-rich foods. Potassium helps balance sodium's effects in the body. Bananas, sweet potatoes, spinach, and beans are all excellent natural sources. This isn't about supplements. Whole foods are the safer, more reliable route, especially if you have any kidney concerns, which is exactly the kind of thing to run by your doctor first. Now, before we get to tips 4 and 5, the 2 that many of my patients tell me made the biggest difference, I need to ask you for something. If this is genuinely helping you, hit that like button right now before you forget. Here's why that actually matters. YouTube uses that simple action to decide whether to show this video to other people just like you, people your age dealing with the exact same concerns, who may never see this unless you like it. Your one tap could be the reason someone else's father, mother, or spouse finds this information in time. And while you're at it, type in the comments which of these 5 tips you're going to try first. Walking or sodium is enough. I read every comment and it helps me know exactly what to cover in future videos for you. All right, let's continue. Number 4, protect your sleep. This one surprises people, but poor sleep quality is consistently linked to higher blood pressure. As we age, sleep can become lighter and more fragmented, which matters more than most people realize. Try keeping a consistent bedtime, limiting screens an hour before sleep, and if you snore heavily or wake up gasping, mention it to your doctor. That could point to sleep apnea, which has a real connection to blood pressure and is very treatable once identified. Number 5, manage stress in a way that actually works for your body. Chronic stress keeps your body in a state of heightened alert, and that has real cardiovascular effects over time. You don't need to meditate for an hour a day. Something as simple as 5 minutes of slow, deep breathing, in for 4 counts, hold for 4, out for 6, practice daily, has been shown to help calm the nervous system. Pair that with staying connected to people you love. Isolation itself has been linked to worse health outcomes in older adults. So let's bring it together. Cut hidden sodium, walk consistently, eat potassium-rich foods, protect your sleep, and manage stress daily. None of these require a gym membership or an expensive supplement. They require consistency, and that's something every single person watching this is capable of. Here's what I want you to remember. Getting older doesn't mean your health is out of your hands. Your body responds to what you do for it at any age. I've watched patients in their 70s make real, measurable progress by starting with just one or two of these changes. It's not too late. It was never too late. Before you go, if you found even one tip here useful, I need you to do 3 things, and please don't skip past this part. First, subscribe to this channel right now because I'm creating new videos every week specifically for people navigating health after 50, and you don't want to miss the next one. Second, tap that notification bell. Subscribing alone isn't enough anymore. Without the bell, YouTube may never actually show you when I post. And third, leave a comment right now with one word: committed. If you're committing to trying at least one of these 5 tips this week, I read those comments personally, and I promise you, seeing that word from you means more than you know. It also helps this video reach someone else who needs it just as much as you do. Take care of that heart of yours. It's carried you this far. Let's help it carry you further. I'm Dr. Mary, and I'll see you in the next video.